Hello. Hi, everybody. Thanks so much for coming in. We have an amazing guest today who is going to be presenting on their new book, which you can see in the flesh here. But also, I just wanted to announce that we have some free copies for folks who are here in person. I'm sorry for folks on the Zoom if you're unable to join us. If there's any left, you can send me a note and I will be able to have those available for you. But I wanted to introduce our amazing speaker today, Dr. Fleming, who did a degree at UNC, our friends in North Carolina, in the Gilling School of Global Public Health and the Department of Health Behavior, with, I will say, a graduate minor in sociology. And as a sociologist, I'll have you as one of our in-group members, and then did a postdoc at UCSD, and is now an associate professor, so a tenured professor in the Department of Health Behavior and Health Equity here at Michigan. Also a Population Studies Center faculty associate for a long time. We're really thrilled to have Paul as a training faculty member and as a member of the Population Studies community. Paul's also won a lot of awards. I was taking a look at the CV this morning and being very impressed, including last year's Harold R. Johnson Diversity Service Award from the Provost and the Teaching Innovation Prize, also from the Office of the Provost. But also, I just learned about that Paul and team were nominees for the Michigan Emmy Awards and got to go for a film that they created on the deep roots of structural racism. And so multi-talented, this is somebody who everybody here should know. But I will also say the 2018 PAA meetings, if anybody was there, Paul was a poster award winner, so PAA as well. So Paul's work is in, not surprisingly, given the department that he's a part of, does a lot of work on health equity and how it really requires working toward anti-racist policies and implementation. So there's some recent papers in Public Health Reports and the American Journal of Public Health about this. There's also an important article in the American Journal of Public Health recently from 2023 by Fleming et al., titled Anti-Racism and Community-Based Participatory Research, Synergies, Challenges, and Opportunities, that won several awards and was a big download for the AJPH, which is a really important journal for those of us in public health. Paul also does work on policing and on fears of deportation, all issues that are incredibly relevant today. So Dr. Fleming is going to talk about the new book for about 35, 40 minutes. And then after that, we'll have time for Q&A. And if you'd like to come up and get a signed copy of the book at the end, I'm seeing some excitement in the back row about this already, then we can do that at the end. So fantastic. And thanks everybody on Zoom. I'm sorry you couldn't be here. I know the weather is not really cooperating as we return from the Thanksgiving break. Thank you all for being here. I'm going to turn it over to Paul.
Thank you so much. All right, well, thank you for the warm welcome, and I am really excited to be here, and I will just take this moment to give a plug to everybody that if you ever create video content, you can submit it to the Michigan Regional Emmys and be nominated for an Emmy yourself. And when you win, which I didn't win, but when you win, they actually give you a trophy that is the exact same as the trophy that all the famous people give. So start creating your video content, submit it in, and you could be an Emmy nominee or a winner. So I'm really excited to be here. One of the other things kind of in my past is I was a trainee at the Carolina Population Center, which obviously is sort of a peer sister institution to the PSC here. And so it's really great to be in front of a Pop Studies audience with you all today. I'd love to get just a sense of who we have in the room. It's going to be harder with the Zoom folks, so I apologize. But who in here is a trainee or a student in some way? Maybe a show of hands. And who is a faculty member? Okay, awesome. And raise your hand if you have training or background or work in the area of public health. Okay, great. And then what about like sociology or political science? Great. Or econ, I should have mentioned econ too, yeah? Okay, well, great. That gives me a great sense in the room. As always, already shared, my roots are in the field of public health. So I've been working in the public health area for about 2 decades. What I write about in the book draws on a lot of ideas from the field of public health, but also from spaces that are thinking about equity, which I know some of these other disciplines are also thinking about and doing research on issues of inequality and other things. So I'm excited to share a little bit more about what's in the book. I do want to give the kind of disclaimer from the outset. This is not really a research presentation. I will present a few figures in it, but by and large, what I am inviting you to do today is to kind of step away from thinking about the nitty-gritty research that you do, or the kind of very niche areas that we all work on in different ways, right? Step back and think about how do we build a better society? How do we build a better world? And that's ultimately a bit about, what the book is about. It's tackling a very big issue that is, how do we actually imagine doing better in our world? So I want to start by reading just a beginning part of the book. 200 years from now, the sun will rise on a world that is hard to imagine. Children will live in that world, waking up to a reality built on the choices we are making today. Those children may not think of us, but I think of them. I wonder what brings them joy. I wonder what they are excited about. I wonder what they feel scared of. I wonder what opportunities they will have. I wonder if they feel safe. I wonder if they are proud or ashamed of the choices their ancestors are making. So this idea of thinking into the future really draws on indigenous perspectives of 7-generation thinking, which you may have heard of before. So different indigenous groups, including the Iroquois and others, often when they were trying to make big decisions or policies for their community or for their society, they would use 7-generation thinking to think about how does this decision impact people 7 generations into the future. I want to highlight a quote by Oren Lyons, who is a member of the Onondaga and Seneca Nations of the Iroquois Confederacy, and also is really involved with the human rights committees at the United Nations. He says, "In one rationalization upon another, you continue the exploitation for wealth and power. But you must consider in the process and in choosing the direction of your life, how will this affect the 7th generation? Where are you taking them? What will they have?" And so when we think about this quote and this idea of thinking into the future, and then we reflect on where we're at in this present moment today, we are certainly on a path towards a certain future, right? And if we think about where we are, it's easy to imagine that the path we're on, if we continue down this path, it'll lead to further political polarization that will rupture. Some have argued that we're already at a rupturing point. The planet will continue heating up, and we will see climate catastrophe after climate catastrophe, right? And corporations and oligarchs will continue to accumulate power and exploit workers. But we can also choose a different path. We can choose a path that is focused on human dignity. We can choose a path that is focused on more equitably sharing resources. And we can choose a path that is more sustainable, that focuses on stewarding our resources and stewarding our planet towards a better future. And so these ideas, essentially thinking about the path that we're on and how can we get towards a different path, are really some of the things that inform the book that I wrote, Imagine Doing Better, and inform the concepts that I put in there. So today I want to talk about the 3 different sections of the book, which are imagination, reflection, and action. And when we think about kind of how we get towards building a better world, we need to be using our imagination, reflection, and our action to be getting there. So the first one is imagination. And part of this is, if we want to build a better world, if we want to create that other path, we need to be able to imagine it. And we need to be able to not just imagine it in some vague sense of some utopia, but we need to actually imagine in vivid detail what it looks like, what it feels like, what it sounds like, right? We need to be using our imagination to think about what that world looks like. And so I'd love to just draw on another story that I tell in the book. But that imagination piece is really one of the foundational things. I remember I said imagination, reflection, and action. So eventually we will get to the action part. But imagination really sets the foundation because it helps us think about where we want to go. And if we don't use our imagination, we can really be constrained in different ways. So I want to tell a story that is in one of the chapters in the book. And it's actually a story of my son from about 5 years ago. So about 5 years ago, my son was only 5 years old. And if you think about when you were 5 years old, or I'll at least share about how I think about when I was 5 years old, that's one of the first times that I'm kind of making memories, right? If I think about my earliest memories, I was about 4 or 5 years old when those things were happening, right? And so when I was 5, and I think this was true for my son as well, he's just kind of opening his eyes to the world, starting to understand how different things are working. He's connecting the dots in different ways, right? But 5 years ago, when my son was 5, it was kind of the initial days of the pandemic, right? And so just as he was kind of coming into this space of understanding the world better, everything was shut down. And of course, his dad is a public health professor. So I was following all the rules, right, of kind of not going out. So when the stores were closed or you could go to stores, I wasn't bringing my kids with me. So my son was not going to grocery stores and other places. I should also note that his mom is a public health nurse. So we were full on public health mode. We were there. And so probably for that 2020, 2021 period, my son was not really going out to stores with us. If we went shopping, we would do so kind of one adult at a time, right? And leave the kids at home. And I remember at some point in 2021, as things were starting to open up a little bit more, the vaccines were coming through, we started to feel more comfortable bringing our kids. And I went out on an errand and I brought my son along. And we went to the store, Home Goods. How many people have been to Home Goods? What do they sell at Home Goods? Everything is a good answer. Also, for folks who haven't been there, they more or less sell home goods in all different types, right? All different types. So the idea that they sell everything. But most people don't think of Home Goods as a toy store, right? It's not really a toy store. It's kind of a toy store for grown-ups, maybe, as you're trying to furnish your house and get different lamps and tables and whatnot. But it's not really a toy store, especially for a 5-year-old or a 6-year-old. But you may or may not know this, most Home Goods have a tiny little aisle that does sell toys. And I'm guessing they do that because they know people like me bring my 5-year-old kid, right? And then what happens? The kid gravitates towards the little toy aisle. And that's exactly what happened with my son, right? I don't even remember what we were shopping for at the moment, but he sees the toy aisle and he gravitates towards it. And he is so wide-eyed. And I realized in that moment that he hadn't really ever been to a toy store. I mean, he had when he was a toddler, right? But he hadn't recently been there. I don't think at that moment he had been to a Target, for example, right? And so this measly little aisle in a Home Goods was really amazing to him. Now, most of us know that what's actually really cool is the aisles upon aisles upon aisles of toys in a Target, right? Or I think I just learned recently that Toys R Us is still a thing. So if you go to a Toys R Us and there's a bunch of toys, right? That is a true toy store toy thing. But my son gravitated to the toy aisle because he really didn't know. He hadn't really been exposed to many toys. Honestly, he had mostly been exposed to the toys that were in our house or maybe the few friends that we had been visiting, right? So he gravitates towards this toy aisle and he's really amazed and he locks in on this little plastic dinosaur. It's about a foot tall. And if you I think if you crank its arm or press a button, it makes a measly little roar. Yeah, pretty unimpressive, to be honest. And that's exactly what I was thinking. But he, like kids do, he was like, Dad, can you get this for me? Can you please buy this for me? And I guess I'm a strict parent. No, like that's not what we're here for. We're not buying toys, right? And also in my head, I'm thinking, I mean, you sort of like dinosaurs, but that's not actually your thing. Like you really like lions and leopards and other predators on the African savanna. That is your thing. You make me play that with you in your playroom all the time, right? Dinosaurs have never been a big part of your kind of what you're interested in. But he was gravitated to this toy in the small toy aisle. And he, again, asked me if I would buy it for him. I said no. And I kind of reminded him, I was like, you have some money in your piggy bank. So if you really, really want this in a few days, I'll bring you back and you can buy it. But I am not buying this for you with my money. I think it cost about $12. So we went home. And the next couple of days, he remembers this dinosaur. And he keeps mentioning it. And he's like, Dad, I want to go back and I want to buy this dinosaur. Okay. So we go back. He uses his own money. He buys the dinosaur. We bring it home. He plays with it for about 17 minutes, casts it aside, and he's done with it, right? Which I could have predicted, right? Because the kid doesn't really love dinosaurs. Okay, so what's the broader point here? Why am I telling this story? So I want to read another section from the book. So spending $12 without thinking through all your options is usually no big deal, right? So my son spent that $12 only thinking about the home goods toy aisle, not thinking about everything he could have possibly bought with that $12. So spending $12 without thinking through all your options is usually no big deal. But what about $6 trillion? That was the US federal budget for 2024. How much of that spending and those policy choices were limited by our collective imagination? What if we stepped back from a decision to spend more than $700 billion on the military and instead asked ourselves, what are the goals for that money? If my son's goal was joy, we could have processed all the things that make him feel joy. If our goal as a society is safety, then what are the things that make us feel safe? If our goal is health, what are all the things that contribute to our being healthy? So the point here is that my son's imagination was limited to this one little aisle, right? He could have bought any number of things for that $12 that would have brought him more joy, but he just couldn't really imagine what those things would be, and he was constrained to what was in front of him. Part of the reason that imagination is so important is that we often get locked into what is it that we have right now, and we think those are our policy choices. And what we need to be doing is stepping back from what we have right now and really dreaming big, using our imagination. What is it that we actually want for our systems? What is it that we actually need? What would actually enable folks to thrive in our society? And what we do a lot is think about the policies choices that we've made decade after decade, and we think about how can we tinker with them? How can we change it just a little bit instead of really thinking about what is the systems and policies that we need? So imagination really helps us expand our thinking and expand our mind on what's possible. So that's the first section on imagination, and the first part of the book is on that topic. The second section of the book is focused on reflection. And I really love this artist. You'll see one or two other pieces of art by Ali Costello later, but if you're on the right path, if you are intentionally trying to reduce the gap between your values and your actions. And so this idea, when we think about reflection, is we are reflecting upon our systems, we are reflecting upon our policies, and we are really examining who do these policies work for, who do they not work for, what types of inequalities are they creating, and really reflecting on what is it that what do we know? And this is actually a space where a lot of you in the room do work, right? Part of reflection is doing research, reading, looking into, studying the problem, right? So that is part of the reflection process. And in the book, I highlight this concept of prevention thinking, which those of you within public health, this should be very familiar for you. And even if you're not in public health, you've likely been exposed to this idea. It's not revolutionary, and it's not, I didn't invent it, right? It's the idea, though, of really thinking about how do we prevent things, right? So when I talk about prevention thinking in the book, I'm talking about three key things. That first, we are identifying the root causes of an issue. Second, we are going to prioritize primary prevention. And for those of you that aren't familiar with the concept of primary, secondary, and tertiary prevention, primary prevention is when we prevent something from happening to begin with. There's secondary and tertiary prevention that we talk about in public health. And what those are is that once something has happened, we try to make it less bad, right? So you can think about, medication for diabetes is trying to make the diabetes less bad. But what we ideally want to do is prioritize primary prevention, where we are preventing the bad thing from happening in the first place. And then finally, we want to be involving impacted communities in the decision, right? Or in what is going to happen. So this prevention thinking, we talk about a lot in public health, and we are often focusing it on the issue of health outcomes. And what I invite the reader to do is that this prevention thinking can actually really guide our public policy making more broadly across our societies. Because if we do think about our society and think about the different issues we have, whether it be crime, poor health, our education system, if we think about what are root causes, if we try to prevent harms before they happen, and then we involve impacted communities or relevant communities in creating the solutions, we will get to different types of policies. We will get to policies that better serve us. And there's an allegory in public health. I would guess many folks in the room have heard it already, but it sort of illustrates this prevention thinking. And the idea is that you come upon a river, and there's a couple of people drowning in the river, right? And so you rush in to save them, and you pull them out of the water, and then all of a sudden you see that there's more drowning people in the river. So you rush in and you save them, and then there's more drowning people in the river. You rush in to save them. And as you look further upstream, you see that there's something further upstream that is causing the people to fall in the river. In this illustration, the allegory changes depending on who's telling it, but in this illustration, the bridge has a huge crack and is broken, right? So people are falling in, right? So this idea of prevention thinking invites us to not just focus our energy on saving drowning person after drowning person, but really to travel upstream and think about what are those root causes, what is causing the issue in the first place, and let's focus our attention on that, right? So investing our money in putting 10 people on the riverbank to save people drowning, right? That's one way that we could solve this problem. Another way is to invest that money in fixing the bridge, right? So that's sort of the idea here behind prevention thinking. So in the book, I talk about 5 different policy areas that we can apply prevention thinking. They certainly aren't the only policy areas, but they're ones that I've done a little bit of work in the past and are super relevant to our kind of policy making as a country. Those policy areas are our healthcare policies, our education policies, environmental policies, criminal legal policies, and public safety policies. For the sake of today, I'm just going to talk briefly about healthcare policies and criminal legal policies to just illustrate sort of what this reflection looks at, how we might look at things through this lens. So this statement on here is a little bit obvious. So policies that help prevent poor health can save lives, right? So the more that we can orient our policy making towards promoting good health, we're going to save more lives. And applying prevention thinking to healthcare and health is sort of the bread and butter of public health. So those of you who study public health are going to be familiar with this. But just as a for example, right? So in our country, we have an issue with people being uninsured, right? And we have tried to use policy efforts to address that issue. One of those most prominent ways recently is the Medicaid expansion. So the federal government made it possible for many states to expand eligibility for Medicaid. Some states said, yes, please, let's do that thing. And other states, mostly led by the opposing political party, said, no, we're not going to do that thing. We don't want to expand Medicaid. And researchers showed that if you lived in the states that actually expanded Medicaid, there were 19,200 lives saved in the period of 2014 to 2017. So almost 20,000 lives were saved merely by that policy choice to expand Medicaid. And if you lived in one of the states that did not expand, there were about 15,600 people who died because that did not get expanded, right? In Texas alone, there were about, I think it was 2,100 people that died in that period because Texas had not expanded it. So those are policy choices, right? And so when we reflect on our policies, we see who they're working for and who they're not working for. But I also want to highlight, and this graph shows life expectancy versus, life expectancy versus health spending. And so you can see on the x-axis, it's healthcare expenditures per capita. So you have $2,000 per capita all the way on the left side, up to $12,000 all the way on the right side. And then on the y-axis, it is life expectancy. So you see 70 years, 75 years, 80 years. So I want to highlight the United States first off. The United States does have, they're not the worst on life expectancy at about 80 years. They are much farther to the right on healthcare spending, right? So we by far spend the most on healthcare as a country per capita. And we get a life expectancy about 80. You can see kind of countries in Europe and also Japan and others have a much higher life expectancy, more in the range of 82, 83, 84, 85 years, and they spend much less. The other one I want to highlight here, though, is Costa Rica. So you can see on this that Costa Rica spends about $2,000 per capita on healthcare expenditures, and they have higher life expectancy than the US. And Costa Rica is really an example of applying this prevention thinking to our policies in the healthcare space. So what does Costa Rica do? They have a system of community-oriented primary healthcare. So they don't just wait for people to get sick and then come to their clinics and then charge them money to get services. What they have is they have an integrated system that, yes, they have primary care and also hospital systems, et cetera, but they actually have all of that connected to teams of community health workers that are working in every single community. So this graphic, which was made by the Commonwealth Fund, kind of demonstrates that there are community health workers that are in the churches, for example, giving talks about health and healthcare and other things. They are visiting the homes. So every home in Costa Rica gets a visit from a community health worker 2 to 3 times a year. And that community health worker is checking up on vaccine status. They're checking up on the health of folks. What does that family need? and then they are directly connecting them to primary care services where folks are able to get the health care that they need. So this is an example of using prevention thinking. On a basic level, yes, we just need all people in our country to have access to health care. So if everybody was eligible for Medicaid or for some type of insurance, that would be an improvement. But even deeper than that, if we really go to the root causes, we need to think about how we have an integrated system where prevention is at the forefront of how we think about health. We are promoting health rather than just trying to prevent the harms after it already happens. So I want to talk, another chapter in the book is focused on criminal legal policies. So when we think about, and I'm kind of lumping these together, although there are two chapters in the book of public safety and criminal legal policies. But when I think about criminal legal system and policing, they are not really using prevention thinking. Most of those resources are not oriented towards trying to prevent harms or crimes from happening in the first place. They are focused on addressing the harms after they happen, right? So a crime occurs, and then the society marshals lots of resources to try to address that crime that happened through policing, through prisons, etc. And I want to share a stat. So the average cost to imprison someone for 1 year in the US is $42,672. The median annual income in the US is $40,480. So we spend more per year to imprison somebody than we could to give that person a salary. You can make all sorts of comparisons. We spend more than it would cost to send them to college, more than it costs to house that person for a year, whatever you want to use as your comparison point. So this is an example of sort of how much resources we put into the problem after it already happens, right? The person who is imprisoned, there certainly are people who are wrongfully accused and convicted that are in prison as innocents, but there are also people in prison who did do something bad. They did commit a harm, they did steal, they did commit violence, right? And then we're putting $42,000 into addressing that problem after the fact. And so what if we thought about that investment of how could we use prevention thinking to change that, right? How could we invest in things that would actually prevent that harm in the first place? The other thing when we think about this concept of reflecting on what we have, people at the PSC and elsewhere have done the research on the harms of our criminal legal system and our policing system, right? So there's research that shows that for every year somebody is imprisoned, they lose 2 years off their life expectancy, right? So if you are in prison for 10 years, you can expect to have 20 years lower life expectancy than your peers. We also know that from Pop Studies research that people who live in communities that have a higher incarceration rate, those people, even if they themselves are not incarcerated, are more likely to have chronic diseases, mental health issues, and other health problems. So these things are impacting individuals, but they're also impacting impacting negatively our wider communities. We also know that police kill 1,000 people per year, over 1,000, and that has remained steady. It has not changed in the past decade. And they injure 50,000 young people every year. Now, we ask police to do a lot of different things in our society, and they do serve a function. So I don't put this stat up here just to demonize police. But the point being is what we have asked as a society and what we have laws and policies that we have asked our police to do, it is causing real harm in communities. And that's not necessarily the fault of the police, it's the fault of the politicians and the society that have asked police to operate in a certain way, right? And then research from right here at Michigan, Michael Esposito and others showed that being killed by police is the 6th leading cause of death for young Black men, right? And they're disproportionately impacted by police violence. And so there are real harms to the choices we are making right now, right? And so this is what part of the reflection part of the book is, really thinking about what do we have now and who is it working for? How is it working, right? So that's reflecting on it. And how could we imagine doing better? So just as an example, and of course I write more about it in the book, is we can think about restorative justice practices, right? That are less focused on punitive jail time, for example, and more about repairing the harm that occurred. So it often engages a victim and a perpetrator in a restorative process. Of course, the victim agrees to it. And so these restorative practices can be integrated more and more into our society as a way to address these harms without focusing so much on the punitive, which does not show to reduce recidivism. The other thing, and this is an area that I've worked on with some folks who also have been part of the PSC, Marin Spolum and others, but unarmed non-police response programs. So we've published a couple of articles on this. These are programs, so right now, if you have an emergency, one of the only people you can call in your community is the police. You, of course, could call a neighbor or a friend or things like that, but from a kind of municipal level, you can call the police or maybe you can call the fire department, right? Unarmed non-police response programs are popping up across the country. Cahoots is the most prominent example. It's been around since the 80s, but there's also a program in Denver, a program in Durham, North Carolina. There's not really any program or at least a municipal-led program in the state of Michigan, although folks have been trying in Ann Arbor and other places. But the idea is that when you have an emergency, you call an emergency line, and the people that show up are trained as social workers, conflict de-escalators, trained in basic medical care, right? Their role is care first. They are providing care to you in a time of need, right? Police can sometimes show up with a care first approach, right? But we have asked police to show up in this role of detaining people, arresting people, and they show up with guns, right? So oftentimes that can escalate the situation because there's risk of arrest. There is risk of bodily harm, as I already stated, right? And there are some members of our community who have been historically harmed or are harmed in present day who are not willing to use that resource, right? So we know that a lot of Black communities or people within Black communities don't want to call the police. People within immigrant communities don't want to call the police in a time of need. Unarmed non-police response programs can fill that gap and provide a resource that is oriented at care first and connecting you to resources rather than oriented towards arresting and detaining and criminalizing. So this is just an example of how we think about shifting our policies towards a different orientation. Now, I want to talk about the final section of the book, which is focused on action. So we talked about imagination, we talked about reflection. So now the final part is on action. And I divide this up into, really thinking about how do we transform our society, how do we transform our policies? Because a lot of folks, especially in 2025, feel like making big change, it's too hard, it's not gonna happen, we're stuck, nothing's gonna work, right? So what I try to do in this last section of the book is really break down what tools we do have if we do wanna work towards change. So I have chapters on where we transform, how we transform, and what we transform. So I wanna give an example of what this looks like. So who knows what these shapes are? Gerrymandered districts, yeah. And do you want to explain what gerrymandering is in case somebody doesn't know it? Not to put you on the spot, but. Yes, exactly. Thank you. So these are politically gerrymandered districts. So, theoretically, legislatures or whoever's creating districts is supposed to create districts that map onto different communities or different regions, and that's the districts that then represent you in Congress or a legislature, right? What has happened with political gerrymandering is oftentimes this process is controlled by a partisan body like a state legislature. And the state legislature will create maps that look like this to kind of lump certain people together and keep other people out so that certain districts, so that overall those districts, when they vote, it will help make that state legislature one party or the other. Both Democrats and Republicans have engaged in partisan gerrymandering. And you can get some districts that look like this, really oblong and weirdly shaped. So in the state of Michigan, we previously had congressional maps that were created by our state legislature. And our state legislature, when it was controlled by the parties, would engage in partisan gerrymandering. And they would create some funky looking districts that didn't really map onto how people thought of their communities or their own region, right? And in 2016, I'm guessing all of us remember the 2016 election. It's hard to get out of our memory. But in the 2016 election, of course, Michigan played a pivotal role in the presidential election. It went by just a few thousand votes to Donald Trump instead of Hillary Clinton. And so that was happening at the presidential level. But if you looked in 2016 also at the state level, the kind of congressional delegation to DC, but also the state legislature, it just like in the presidential results, it was basically an even split. It was 49.0 voted for Democrats and 49.1% of voters voted for Republicans. And that's what the kind of voter split across the state was. But it gave Republicans an overwhelming majority in the legislature because of this partisan gerrymandering. And so I want to tell the story of Katie Fahey, who was a Michigan resident who helped address this issue. And it really is an example of the type of action that we all can be taking as we think about building a different society and transforming our policies. So Katie Fahey lived in West Michigan. She was 27 years old, and she had not really been involved in political campaigns of any sort, right? So you can kind of think just average 27-year-old in West Michigan. And on the day after the election, she woke up and she was really upset by the results, not just at the presidential level, but also looking at the state legislature results and thinking about the partisan gerrymandering. So she woke up, and at some point the day after the election, she made this Facebook post. She said, "I'd like to take on gerrymandering in Michigan. If you're interested in doing this as well, please let me know." So she went to her social network, Facebook, posted this. It ended up getting a lot of likes and a lot of shares, and a lot of people were interested. So Katie then convened a meeting, a virtual meeting, and about 50 people showed up, and they strategized what they could do together to take on gerrymandering in Michigan. They identified what other organizations were already thinking about and working on this issue, and they partnered with them, and they ultimately created a campaign that got a constitutional amendment on the ballot in 2018. So if you remember, if you voted in Michigan in 2018, we voted on a constitutional amendment to change the Constitution so that it was not the state legislature that made the congressional map or the legislative districts, but it was a citizen-led districting commission that was bipartisan, and it was led by citizens. So Katie was a fundamental player in this by bringing people together and helping. Katie and her group ended up collecting hundreds of thousands of signatures to get this on the ballot in the first place, and then helped the initiative win. And it won by over 60% of the vote. So it was an overwhelming victory in 2018. And if you look at our results now in present day, you may or may not like the exact results that we have, but when you look at the split of voters and the split in our legislature, it is much closer to a match than it was in 2016. And so what is this an example of? This is an example of some of the action. Now, I'm not saying that all of us are going to go out and make a change to the Michigan Constitution, although maybe we could and we should, right? But there are some lessons from what Katie did. So I just want to highlight a few, and then I will be wrapping up. So the first off is that Katie, and this is really a fundamental part of any action we're going to take, right, is thinking about who you are and what role you can play. So you are understanding yourself and what role you might play in an issue, right? So with Katie, she understood that she was a political novice. She had never run a constitutional amendment campaign before, right? So she needed partners. So she found different partners who had been working in the state for years and years and decades, right? She also understood that she did have a network via Facebook that she could bring together and that she could be a leader in certain ways, right? So understanding yourself and what role you can play. Whatever issue that you're interested in tackling, you need to understand who you are. And what I mean by that is what identities you hold, what privileges you hold, what disadvantages you hold, how you're connected to an issue, right? Before you start taking action. The other thing that Katie did was she found her communities, right? So whenever we are thinking about making change or how we can take action, doing it by yourself is always going to be quite limited, right? So finding your communities. Sometimes that is a small community of, other PSC trainees, for example. Sometimes you are part of a PTO community at your kids' schools. Sometimes you are part of a church community, right? So who is your communities? Can be big communities, but find people. And this can look as simple as you have something that you are feeling upset by or you would like to change, and you bring a group of 2 to 3 friends together for coffee, and you talk about it and you strategize together, right? So find your communities and bring people together. That's a key role that we all can play. The other thing Katie did was thinking in a long-term perspective. Now, she actually got a win in a relatively short period of time, right? She got a constitutional amendment changed in just a couple of years. But when we think about the bigger changes, when we go back to that imagination and really thinking sometimes 7 generations into the future, we need to be using this long-term perspective. And there's an organization in Detroit that I really love that uses this 10-3-1-3 idea, which is they set a vision for 10 years into the future. And then they think about, okay, if we want to achieve that in 10 years, what are we going to have to do 3 years from now? So then they kind of detail what that 3-year thing is. And then once they have that set, if we're going to do that in 3 years, what do we have to do 1 year from now in order to be set up to succeed for that 3-year plan? And then once they have the 1-year plan set, if we are going to succeed at hitting that 1-year goal, what do we need to do in the next 3 months, right? So you might have somewhere, and we can think in the really big way, right? Like, where do we want our society to be in 10 years? Where do we want it to be in 50 years? What big change do we want? But then we scale it back and we break it down into smaller steps, right? So Katie Fahey, with her constitutional amendment, she was able to see that the long-term goal was this constitutional amendment change. That wasn't going to happen in a month, right? She needed to use this long-term planning and then break it down. And then the final thing is thinking about orienting ourselves towards root causes, right? So Katie Fahey was frustrated about kind of what the results of the 2016 election were. And she honed in on political partisan gerrymandering, right? Which is really a root cause at how our democracy works, how it functions, how it represents people. She could have responded by just thinking about, voter mobilization. I'm going to sign up as many voters as I can in my neighborhood. And don't get me wrong, signing up voters is important. Voter mobilization is important. I'm not at all saying that that's not important. But what she did is she oriented her energy towards a root cause. This partisan and political gerrymandering was causing issues in our democratic systems. And so if we could change that, we could get better outcomes, right? So we need to think about what are the policies, the systems, and the narratives that are really at root of the different problems that we see, and think about tackling those. All right, with that, I am going to wrap up my talk. But I appreciated the all the different ways you guys listened and nodded along. I always like that in an audience. And I would love to take some questions. This QR code is just a link to be able to order the book from the publisher if anybody's interested. They have a Cyber Monday sale right now. But yeah, I'm very eager to hear kind of any thoughts you have or questions you have for me. Thank you.
Questions from the room? Let's see if anybody on Zoom has a question.
Hi, thank you so much for this talk. Thinking about this as like a demographer, I feel like there are cohort differences to like social change, and I'm wondering if your experience talking to audiences, if you've come up with different strategies for like convincing people about like taking action. I feel like being part of like the older generation Z, like we like have experienced so many events in our lifetime, school shootings, the pandemic. I think a lot of people are already convinced that there needs to be change, but I feel like it's harder to talk to people in different cohorts.
Yeah, no, that's a great question, and I do think different generations, different ages are going to look at this differently. I think what I tried to do in the book is, when we think about action, is really breaking it down into, there's a lot of different ways we can take action. For some people, and I have actually talked to some of the audiences I've talked to people who are more sort of in the retiree age group, well past a career, and they're like, I just don't even know where to plug in or get involved. And one of the things that I've shared, first off, there are lots of different ways that retirees or anybody of any age group can get involved, whether it's in joining an advocacy group, in bringing together friends, whether it's, so there's all different ranges. But one of the ways I like to really break it down for people is, you can do something as simple as baking cookies and delivering it to somebody who you feel like is making change in the world, right? That small act is supporting that person who's then going to do something else, right? So there is sort of a chain reaction to all of this. I think another piece of it is, right now there's so many people who are really struggling to hold on to hope and feeling like a better world is possible, right? And so there are ways that we can show up for each other in helping to provide hope or sustain hope, right? So those are much more at that like interpersonal level. And while, yes, ultimately our broader action needs to be pointed at some of these bigger systems and policies, we do need to break it down into things that we can actually do on a day-to-day level. And a lot of times those things can be very, very small. And if everybody is doing the small things and supporting each other in different ways and trying to take one small action each day or each week or each month, I think there are, getting back to your question, there are sort of entry points for different people along the spectrum of where they're most comfortable getting engaged. And I think the key is to, do something. Now, and I want to just highlight one more thing, because in one audience I had somebody say, but you know what, I feel so kind of beaten down and battered, and I can't bring myself to do anything. And what I said to that person is, then the most important thing you can do in that broader vision is you can rest right now, because this is a relay race, right? So some other people are going to be taking action, and you need to be ready in a year or 2 years to give somebody else a break so that you can jump in, right? So I think that's another way to kind of think about that doing something, taking action, that it doesn't mean that we all need to just grind, but it does mean to be kind of cognizantly thinking about what that future world we want to build, and what are we doing strategically to get there.
Oh, we had 2 people. I saw hands moving. I don't want to take your question. No. Kaylee, I think it's you then.
I have a big old question,
Okay.
but I think it's a wonderful message, and it's a big message. So like Kelly, I'm also coming from a demography background. And so one of the things that I study and that I'm thinking a lot about is population aging. And with that comes, so I'm thinking about in particular when we're thinking about reimagining healthcare systems to have these structures better serve people. And so I guess I'm just curious about your thoughts on how we're kind of orienting a prevention approach to folks who may have, you know, they're past the life stage when we could have some of these like early childhood interventions, which are important in their own right. But if you're 65, what's it going to do for you? And they already have chronic conditions. So when we're thinking about population aging as this huge societal force where we're going to have a lot of folks who are kind of past those prevention stages for some of the things that we know are most effective, how are we kind of reimagining when we have a lot of increasing reliance on some of these structures that are already taking care of people, even if we know that's not the most efficient, you know, we're facing an increased burden of people relying on the structures that we do have. So just thinking about
Yeah, that's a really important point. You know, I think where my mind goes is in some ways the way we have our policies set up is that our healthcare systems and to some extent social services as well are the only ones that are kind of trying to support the older population. And so part of prevention thinking, I think, in this case is thinking about what are the community networks and the community responses that can kind of be set up to provide both different forms of social support, different types of home care, other things, so that you know, and it draws on the concept of mutual aid, which is one of the things that shows up in the book, is this idea that we do need policies that kind of build the structures, but sometimes the policy change can take a long time. And mutual aid can be something that is really powerful at helping provide for people's needs and providing a sense of connection when policies are failing. Our policies are inadequately serving the community. So I think the way that prevention thinking might get applied in this case is thinking about what different forms of mutual aid can be built up and supported within communities, can even be fostered or you know, resourced through the health systems to help provide more services for those populations. Thanks for the question.
Thanks so much, Dr. Fleming. If you would like a book, we would love you to have one. So if you want to come up here and even get it signed by our almost Emmy-winning Michigander, please join us. But thanks everybody on the Zoom also for being here. And I thank you all as a wonderful audience.